Hello viewers, you are watching me Zahur Islam. This is my lecture number 188 and pregnancy related lecture. So I think this is the third lectures. Today I will teach you about the drugs affiliated with some risks. So there are some of the drugs which are associated with risk during pregnancy, and repeat the unsafe drugs as discussed below, and you can show all these agents in the table too. Anti-asthmatic agents, for example, Chromolyn sodium. Chromolyn sodium, it is used for the prophylaxis in bronchial asthma. It slows down the fetal growth if taken in large doses, but it doesn't have teratogenic effects. For example, let's suppose if Chromolyn sodiums become overdose. So due to overdosing, there may be chances of teratogenicity. But you will have to care about all these agents whenever they are used during pregnancy. Corticosteroids, these drugs should be avoided during pregnancy as it has adverse effects like malformations and growth retardation or retardations of the fetal growth. So the growth of the fetus had become stopped. So corticosteroids, they are not safe during pregnancy. So it is very important to know about each and every drug and its uses. So now let's see here, this is the chemical structure. So in figure number 6, a gastrointestinal agent, Antacid. So it is a substance which prevent and neutralize the stomach acidity and also relieve the heartburns. These are the OTC, over the counter agents, drugs which are taken orally to relieve the acidity and heartburns, like antacids like aluminum hydroxide and sodium bicarbonates. So it will be shown in figure 7. Magnesium trisilicate and calcium carbonate adversely affect the fetus, so they shouldn't be they should be avoided. For example, we are using certain kinds of drugs like mucans, so which contains aluminum hydroxides and magnesium trisilicate, calcium carbonate. So all these antacids, it should be avoided. Anti-emetic, so it is a substance that is effective against the nausea and vomiting. So during pregnancy, vomiting and nausea, these are the common signs symptoms which are reported during pregnancy. But it is mostly used in motion sickness. But some drugs like cyclizine, which is shown in the figure 7, hydroxyzines and trimethylbenzamides and chlorpherazine in pregnancy didn't show good result. Let's see here. This is sodium bicarbonate antacids, while the cyclizine anti-emetic and cimetidine cimetidine is anti, you can say, histaminic as well as H2 receptor antagonist antacid. So these drugs, these are unsafe gastrointestinal drugs during pregnancy. Now come toward H2 blockers or H2 receptor blocker, H2 antagonist. So H2 receptor antagonist is a class of drug that block the action of histamines on the parietal cells in the stomach, which decrease the production of the acids. So drugs like cimetidines, which is shown in the figure 7, and ranitidines are given during pregnancy, but their frequent use should be prohibited. So it is very important to know that H2 receptor antagonists like cimetidines, so it can directly block the action of histamines. So you know that histamine, these are also autokines or histamines. These are the chemical substances which is released by the basophils and mast cells on the parietal cells, especially in the stomach, and it can directly decrease the production of acid. But drugs like cimetidines and ranitidine, they are given during pregnancy, but their frequent use should be prohibited. Now come toward a list of antibiotics like antimicrobial agents. So chloramphenicol, it is an antibiotic which is useful in the treatment of serious infections such as typhoid fever, but it doesn't have any adverse effect but may cause gray baby syndrome and reversible bone marrow depression when it is given just before the delivery. So there are certain complications which are reported here, but this drug should be used with precautions. Nitrofurantoin is another agent, so it is usually effective against Escherichia coli infection or E. coli infection such as UTI, urinary tract infection. Due to its hemolytic effect on the fetus, it should be avoided. Nitrofurantoin, it cannot be used during pregnancy. Sulphonamides, which is also bacteriostatic as well as bactericidal, so which have the capability, potential to block the, you can say, the production of, you can say, folic acid synthesis. So this antibiotic is used against urinary tract infections, but it should be avoided during the third trimester, especially third trimester of pregnancy, as they may be harmful for the fetus in case of for example, third trimester of pregnancy. So this may be harmful for the fetus. Now let's see here all this data. This is actually the research articles. The data is being taken from the, you can say, from the research papers, research articles, which is valid and accurate. So these are the unsafe antimicrobial drugs during pregnancy, especially in antibiotic groups. So this is clear. You can see this is the chemical structure of chloramphenicol and its structure activity relationship, while nitrofurantoins and sulphonamides. So this is in figure number 8. As we have already talked about the antitubercular agents in my previous lecture, so streptomycin, it is one form of produced antitubercular drugs. So in figure 9, it causes a minor effect to the fetus after crossing the placenta. It is mildly given to the patient, which is resistance to the rifampicins. Streptomycin, so streptomycin, you know, this is unsafe antitubercular drug during pregnancy, and the drug which I have already highlights, for example, that is isoniazid, that is safe in antitubercular drugs, while the streptomycins, this is the oldest antitubercular agent, this is not safe during pregnancy, so it should be used with precautions. Now come anti-hypertensive agents. So an anti-hypertensive agent, diazoxide. So you know diazoxide is vasodilating agent. It is anti-hypertensive agents and used as a vasodilators, and especially in an acute hypertension or malignant hypertension. So it can cause damage to the fetus by producing the sudden decrease in the blood pressure, so which is already given in the figure 10. Captoprils, which is also called ACE inhibitors. So it is the first ACE inhibitor that was developed and used for the treatment of hypertension and congestive heart failure. It is given in case when the other drugs become ineffective, which is also given in the figure number 10. Another one is diuretics. So diuretics actually, and diuretics it include ethacrenic acid. So ethacrenic acid, so this drug has been assigned in the pregnancy category B. As we know, there are different categories of drug like category A, B, C, D and X. It is not recommended for the treatment of edema or hypertension during pregnancy, which is a potent diuretic agent because it can induce the maternal hypovolemia, as well as it decrease the placental perfusion pressure. So it is only an alternative agent to furosemide, and the dose depends from patient to patient. Now let's see here. This is the chemical structure of diazoxide, captopril and ethacrenic acids. In figure 10, so these are the unsafe antihypertensive and diuretics drugs during pregnancy. So that is diazoxide, captopril and ethacrenic acids. Another group is you can see here and cardiac on my screen. So cardiac drug that is calcium antagonist. They are also known as calcium channel blockers, which are used as antihypertensive drugs. Drugs like verapamil, which is given in figure 11, nifedipine, diltiazems can be administered during pregnancy, but checking of the fetus should be necessary. It is very necessary to properly check the fetus. Should be, you can say, it is very necessary to highlight, to see, especially it can be administered during pregnancy, but checking of the fetus should be necessary before administration of these agents. You should also targets, or you can diagnose the patient properly. After that, you can recommend calcium antagonist. In anti-malarial agents, primaquines, it is an anti-malarial agent used to treat malaria and pneumonia, but this drug should be avoided during pregnancy as it crosses the placenta and cause hemolytic anemia in neonates, and also show the pharmacological, you can say, pharmacological adverse effects. In all anti-malarial drugs, so they are contraindicated, but one case that is reported, that for example the agent which have a high therapeutic index, so then you can use it. Now come toward analgesics. So an analgesic, salicylic acid or salicylates. So it is the drug that is used to relieve the pain. So there are different classes of analgesic like NSAIDs, COX-2 inhibitors, etc. So salicylates, these are the class of NSAID, non-steroidal anti-inflammatory drugs, where the different types of drug they are available. And figure 11, they are usually used in the treatment of arthritis and various pains. And this drug should be completely avoided during the pregnancy, as it has the potential to cause adverse effect to the fetus. For examples, the adverse effects are neonatal flatulent dysfunctions may be occurs, as well as it decrease the neonatal factor 7, while the respiratory syndrome and neonatal hemorrhage, and decrease birth weight. So these are actually the problems related to these drugs which are reported. So mean this drugs is strictly prohibited. So verapamil, primaquine. So you know verapamil, diltiazem, these are calcium channel blockers, and primaquine anti-malarial, salicylic acid analgesics, and phenetines anti-convulsants. So all these drugs, they are not safe during pregnancy, so it should be used with precautions, or you should consult with the pharmacist. Inshallah, in my next lecture, so we will talk about the miscellaneous agents, and especially you can see the table number 2, a list of unsafe drugs during pregnancy. Once again, I'm very thankful to all my viewers for watching me. So I wish you all the best. So kindly subscribe my channels and like it, watch it. So also press the bell icon for my upcoming lectures. So if you need any kind of content, recordings, anything related to pharmacy, so I'm always available for your services. Wish you best of luck. Thank you.